I am Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity Incorporated. This video blog is on what to do if you suspect a sexually transmitted infection. It's pretty straightforward, actually, and is obviously a very common occurrence. Your first job is to stop the denial. Sexually transmitted infections don't go away on their own. Well, actually, herpes does, but it's more accurate to say that it goes into hiding, waiting to return another day. At the first suggestion of any abnormality such as vaginal or penile discharge, the presence of bumps, a rash, warts or ulcers, itching or burning when you urinate, or an abnormal smell, you must get evaluated. This is clearly an example of it's better to have an evaluation and not need it than to need an evaluation and not have it. STIs cause consequences, including pelvic inflammatory disease, also known as PID, birth defects, and any increased incidence of cancer. Human papillomavirus, also known as HPV, even causes cancer, and without vaccination, virtually 100% of the sexually active population will obtain it at some point in life. Each year, sexually transmitted infections cause at least 24,000 women in the United States to become infertile. You must get all of your sexual partners evaluated and treated. Ping pong is not just a sport. You getting treated without all of your partners doing so as well is pointless. Even your asymptomatic partners can be carriers of the disease. Sorry, folks, but men are much more likely to have symptoms men are much more likely not to have symptoms even when infected. Don't let that fact change the reality of who needs to be told and treated or who could have caused the infection. Not telling your female partners about sexually transmitted infections can have devastating consequences. You should make a commitment to wearing condoms. Either get over the subjective difference in how sexual intercourse feels with and without condoms, or get more creative to adjust for the difference. The issues are common things happen commonly, and the best predictor of future behavior is past behavior. If you have had a sexually transmitted infection, you're just more likely to have others in the future. It's more likely to be in your social network, and you may be the one who is a carrier of herpes, for example. Given that STIs hang out together like a gang, meaning the same individuals infected with one STI are the ones most likely to have others, you want to avoid contact with some of the incurable sexually transmitted infections such as herpes, HIV, or HPV. Here's what we will do if we suspect you have a sexually transmitted infection. When you come to your physician's office or the emergency room with the possibility that an STI exists, or if you know you've been exposed to one, you will be treated. This is not a situation in which we wait to treat some of the more common conditions, such as gonorrhea or chlamydia. Because of the community, dealing with STIs is more of a treat now, ask questions later situation. Besides, many individuals are carriers without the presence of symptoms, particularly those with herpes. I must restate, this is neither the time nor the place to be bashful or in denial. If it is syphilis that is in question, say so. If you have sufficient symptoms, your medical team will figure it out, but it's better for you if you already know what the likely culprit is. You will be asked tough questions. You should not be offended by the questions you will be asked. Physicians are in the treatment business, not the judging business. Expect to have frank conversations about your sexual habits and preferences with or without your partners present. If a definitive diagnosis is made for certain conditions, such as gonorrhea, chlamydia, syphilis, or PID, you will be treated prior to leaving the emergency room unless you have allergies preventing the use of certain medicines. There are two particular considerations for you after you've been treated for a curable STI in an office or ER setting, both regarding your resumption of sexual activity. First, if cultures were drawn, you should wait to begin sex until after these results have been returned. The cultures will clarify exactly which diseases you have and which antibiotics work against them. Normally, this would have been an issue, but antibiotic resistant gonorrhea is a real and increasing thing. Additionally, you should wait to begin sex until all of your current partners have also been treated and cleared. You can and will be reinfected from all STIs on more than one occasion if you continue having sex without everyone in your circle getting treated. Look for additional content on Sphinx TV discussing steps you can take to assist you in your health journey. I'm Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity Incorporated. Thank you for watching. Be safe.